Hello everyone, this is Ola. Now we will discuss the integumentary system, which is the skin and its associated structures. Let's first have an idea about the three regions of the skin. The top one is the epidermis, which is a stratified squamous keratinized epithelium, and the superficial part of the epidermis is called the stratum corneum. It has the dead cells without nuclei that are full of keratin protein. Then above the basement membrane, so between the epidermis and dermis, right above the basement membrane, we have stratum basale, which is the basal layer having the stem cells producing keratinocytes continuously to replace the ones that follow the skin. Deeper to the epidermis, we have the dermis, which is areolar connective tissue in the papillary layer. And deeper in the reticular layer, it is dense irregular connective tissue. Then we have the hypodermis, which is a common site of injection because it has few blood vessels. So if you want a medication to be absorbed slowly into your blood, inject that in the hypodermis, like insulin, for example. We have some receptors and nerve ending through the skin to enable us to feel different stuff. So here in the papillary layer of the dermis, we have the Meissner's corpuscles, and they are responsible for light touch and discriminative touch. Like if you are touching a surface to determine if it is smooth or rough, the Meissner's corpuscles are the ones to detect that. All over the skin, we have the free nerve endings, and they are responsible to feel pain and temperature. And then deeper here in the reticular layer of the dermis, we have the Pacinian corpuscles. They are responsible for deep touch. Like if you put a strong vibrator in your skin, the Pacinian corpuscles are the ones to feel that. Remember, Meissner's begin with M, and Pacinian begin with P, so Meissner's are on top in the papillary layer of the dermis because M comes before P. Pacinian are found deeply into the reticular layer of the dermis. We have the hair follicle, and inside that, we have the hair that goes out through the surface of the skin. Associated with the hair follicle, we have a smooth muscle, this one here, that we call erector pili muscle. It is the one, when contracts, it makes our hair stand up, which is goosebumps. This happens during cold or if we are nervous. Also surrounding the hair follicle, we have a gland that we call sebaceous gland, and this is responsible for oil production to the hair and to the skin. Some people produce more of that. Some people tend to be to the dry side, producing less oil from their sebaceous glands. We have the sweat gland. So the sweat gland has a duct that we call a sweat gland duct. This one here. That's the sweat gland itself. And the sweat gland open to the surface of the skin through the sweat gland pore. Now, we have two types of the skin. The thick, found on the palms of the hand and sole of the foot, and the thin covers most of the body. So what is the difference between the thick and thin skin? Both have stratum corneum, but if you look at the stratum corneum of the thick skin, it's kind of thicker in comparison to the one of the thin skin. And both have stratum granulosum, this layer here, and here. Both have stratum spinosum, and both have stratum basale. The layer that is only in the thick skin is in between stratum corneum and stratum granulosum, which is stratum lucidum. It's only in the thick skin. Lucidum because it's lucid, meaning transparent. Stratum lucidum is kind of waterproof, and this is only found in the thick skin. So the thin doesn't have the stratum lucidum, it has only the four other layers. Okay, if you look here to the papillary layer, they fit the epidermal ridges above them. So here is the basement membrane, and those cells make stratum basale. We call those epidermal ridges. They are the ones responsible for the fingerprints, and they are of different patterns because our fingerprints are also different. So epidermal ridges are the one responsible for the fingerprints. Of course, the epidermal ridges are only in the thick skin. So in general, if you compare the thick to the thin skin, the thick skin is found in the palms, and so the thin most of the body. Stratum lucidum is only in the thick skin. Epidermal ridges only in the thick skin. Hair follicles are only in the thin skin. We don't have hair coming from our palm of the hand or the sole of the feet. Sebaceous gland The sebaceous glands are associated to the hair follicles because we don't have hair follicles in our thick skin. There are no sebaceous glands. How about the sweat glands? The thick skin has many of them. Like we sweat through the palm of the hand and the sole of the feet. The thin skin has also sweat glands, but less than the ones in the thick skin. The sensory receptors are more in the thick skin. We use our fingers to feel, and they have the higher amount of receptors in comparison to the thin skin. Okay, does thick skin have erector pili muscle? What do you think? The thick skin does not have hair follicles to begin with. And you remember that the erector pili muscles are associated to the hair follicle. They are responsible for goose pumps, so they are not found in the thick skin. They are only in the thin skin. If you look at that image, what type of skin in that image? Is it thick or thin? Well, if you look at the epidermis here, we don't have hair follicles, we don't have sebaceous glands or erector pili muscles, and this applies more to the thick skin. If you look at the dermis, here is stratum corneum, and this is stratum lucidum. Remember, stratum lucidum is only in the thick skin. Okay, we have different skin cells. The keratinocytes are about 90% of the epidermis, and they produce the keratin protein for our protection. The keratinocytes start from the stratum basale, and as they travel up to the surface, they proliferate until they go to stratum corneum, when they lose the nucleus and undergo programmed cell death that we call apoptosis. Then they fall off the skin and they are replaced by newer ones. The lifespan of the keratinocytes is about 4 weeks. Melanocytes, they produce the melanin pigment responsible for the skin color, and it absorbs the UV radiation from the sun to protect against skin cancer. Langerhans cells are resident macrophages. Macrophages means phagocytic cells, so they are able to eat bacteria and fight against infection. They are there across the epidermis of the skin, but they can migrate from the epidermis to the draining lymph nodes. The connective tissue of the dermis, we have the papillary layer, and this has the areolar connective tissue, the one that has fewer fibers, a lot of ground substance. Deeper the reticular layer, has the dense, irregular connective tissue, and this connective tissue has the collagen fibers and elastic fibers responsible for the elasticity of the skin. And by age, the skin produces less collagen, leading to the wrinkling that happens with aging.